Hello, everyone.
There you go.
Thank you for coming this evening. I am Dr. Hoffman, and our talk tonight is about recognizing periodontal disease and what we can do to prevent it or to help if your pet has it. Many years ago, I became interested in dentistry because I started to recognize how many dogs and cats have very bad disease. And after I would take care of them, I would see them back. The pet was a new pet, happy, and the owner was happy. So it was a win win situation. I want to warn everybody there are going to be some graphic pictures in this presentation. Okay, so why do we care about this topic?
Oh, dear me.
The most important thing is that our animals deserve a life free of pain, and we can give them that. So tonight, I'm going to show you lots of pictures for you to try to recognize oral disease in your pets, understand how it has to be treated, and then how it is possible to prevent it. Okay, quick definition of periodontal disease. Dontal is the tooth, perio is around it, so it's disease around the tooth. Now, who is most at risk for periodontal disease? Believe it or not, more than 80% of pets over age 2 have some form of it. There's different risk factors, for example, inherited or genetics. Most small dogs, beagles, and greyhounds are known to have very bad periodontal disease. The conformation of the mouth, if you have a brachiocephalic dog where the muzzle's pushed in, there's not enough room for the teeth to extend like they should. And so, because they're crowded, it allows periodontal disease. Lack of home care. Most people don't realize that you even need to do home care. Age, the older the pet, the more likely they're going to have it. And health history, medications they're on, things like that. This is just to have you understand when I use a few words what I'm talking about. So, enamel is around the tooth. And remember, it's very thin, it is half the thickness of ours. The red center area that says pulp is where the nerve and the blood vessel live. And that yellowish bone is what the root of the tooth is enmeshed in this bone that keeps it in place and prevents it from becoming mobile or falling out. This is a normal gum, and really pay attention to how flat the gum is coming up on the tooth. And it's the same color as all of the gums. Here is a dog that has early periodontal disease. And if you look at the far tooth on the right, the far two teeth on the right, you can see some yellowish discoloring. And if you look at the gingiva, you can see that it is red around it. This is a dog that has very bad periodontitis, which means inflammation and infection of the tissue around the tooth. And you can see how swollen that gum is, that it is, if you look at the top of the lip and the bottom, it's not the same color. And I'm just going to go back. There you go. Normal, flat against the tooth, not red. And here we are with puffy, hair trapped, some pus, all in that canine. This demonstrates a lot of the things that we see in periodontal disease. If you look to the far left, where that brown line goes across that tooth, the bone should be all the way up to the brown line. You should not see the part of the root you're seeing. Once bone is gone, it cannot come back. The next tooth also has bone loss, but look at it, almost looks like bloody gum all around it. That's an ulcerated gum. The next tooth, you can see some purulent material. The next tooth, because of bone loss, is allowing hair and things like that to get trapped. And then the canine, same thing. If you look at the top of the brown material, that's where the bone should go up to. This disease has been going on so long that the bone has recessed. This is a picture of a dog, the incisors on the top, and the bone should go across where the bottom of the white is. Again, this has been going on a long time. Almost the entire tooth is shown, and you can see how the gums are pink, swollen, irritated. Again, just showing you when you have bone loss, look at the fur that can get trapped in between the roots or food particles. When you have dentistry done, it allows you to examine the entire mouth, and the photo on the left shows an oral tumor. And the sooner you find those, the better chance you have of curing it, and your pet can continue to live a normal life. On the right side, you see, again, very advanced disease, very irritated gums, fur, all kinds of bad stuff. Okay, so how do you know your pet has dental disease? What are some of the signs? The first one is bad breath. And I'll just tell you a quick story. Many years ago, my family was renting a shore place, and the owner of this house had a pantry. And we were in the living room, and suddenly we heard this loud explosion. And then a cloud, just like that green, came floating in the air, and it was the worst smelling thing in the world. It was anaerobic bacteria. They grow without oxygen and they smell terrible. And that is what's happening in your pet's mouth. We talked about plaque, calculus, ulcerations, bleeding. Again, the bone going back, causing loose teeth. This shows you gingival hyperplasia, which, if you can imagine, there's a deep pocket now between the base of the tooth and the gum, and that lets lots of bacteria grow. So those gums need to be trimmed down to the right area. Pulling at the face, once in a while, I'll hear that dogs do that. And avoiding food, that's a cat issue where they'll go there to the bowl, smell it, they want to eat, and then they'll walk away, or they'll start to eat and then they'll walk away because it hurts. Almost everyone says to me, even with those severe cases, but my cat, they're eating fine. They're not showing any signs of pain. And this goes back instinct wise, because if you were in a pack or out in the wilderness and you let it be shown that you weren't healthy, your predator would get you, or your pack would kick you out. So these are just showing you some sad dogs and then a very angry cat. Okay, this is just going over the bacteria. So the green is the bacteria, and it likes to get down those pockets alongside the tooth. If you have a normal tooth, like the teeth very much in the front or on the bottom jaw, that bacteria cannot get down there. So the bacteria that gets there, air doesn't get there, and that is that really foul smelling anaerobic bacteria. And they are really good at eating your bone and causing lots of problems. Okay, sometimes we'll see this really thick mineral all over the teeth, and you have to really work at, again, this would have to be done as an anesthesia, getting this thick tartar off. Brushing the teeth is not going to do anything for this. This is a cat. On the far right, you can see thick mineral coating that tooth. And then if you look at the canine to the right, you can see a little ring, and that is where the mucosa, the pink tissue, should go to. But this cat has had bone loss, and look at the gingiva. It's pink, it's irritated. Cats also have another issue that is very common, up to 75%, and we don't know the cause of it. They're called resorptive lesions. And if you look at that tooth, you might think, oh, it's got irritated gum growing up, just like that gingival hyperplasia. But it is actually a hole into the pulp cavity, and it is very painful. When your animal is under anesthesia, if you have a cat, we have a very fine probe and it goes around every tooth. And if it falls into a hole, what we'll see is chattering teeth, even under anesthesia. That's how painful it is. Okay, these are photos of more resorptive lesions in the cat's mouth. You can see on the left side, there's only a little bit of crown left. You can see on the far right side that there is still more crown, but you can imagine that hole right into your pulp canal. Here's one, if you look at the canine and you're going around it, you can see that the crown goes up and back down, and that is a hole. Here's another one I just saw recently, two separate holes in that tooth. And also, a little hard to recognize, but on the left, there's also bone loss on that canine. Another wonderful condition cats can have is, does your young cat's breath smell really foul? And that is because there's a condition called juvenile gingivitis. Again, unsure of the cause, maybe partly genetics, maybe exposure to viruses at a certain time in their youth. And the gums are red and irritated. The odor is terrible. And what has to be done with these cats is they have to have a professional cleaning every 6 months, usually by 2 years. If you're successful, it will go away. And then you have to every day brush those teeth after the cleaning. Okay, so what can we do about this? Well, the first thing I'm going to tell you after tonight, don't go out, buy a toothbrush and start brushing your pet's teeth until you know if there's advanced disease or not, because you could be going into the holes on the cat's teeth. You could be, going over exposed roots in the dog's teeth. You need to come in, get a physical exam, and then we decide whether it's mild enough that you can work on it at home, or we need to do something more extensive. If it is mild, we can teach you how to brush the teeth. We have really good videos on our website. YouTube has a million videos. You don't have to, day one, be able to brush. You can take a really long time, weeks, months to get your pet used to it. And then there are other products you can try in addition to brushing, but brushing is the main way to fix it. So say you think your pet has periodontal disease, or the vet looks and sees resorptive lesions, bone loss, fractured teeth. Here is an example of a fractured tooth on the top of a dog. We call that slab fracture. And look what's underneath it, a hole right into the pulp. This is a very common injury. I see it all the times after dogs are given something really hard to chew. Okay, I wanted to go over what we do at Mount Laurel to ensure that the best possible dental procedure and the best care for your pet is given. On the advice of an anesthesiologist, we started years ago sending home pre-surgical medications to give at the house for anxiety and also for nausea to prevent vomiting. And this helps the pet come, not be stressed out like it would, and to have an IV catheter placed without not being really stressed. We do blood work that day to make sure the organs can metabolize the anesthetic drugs, to make sure there are platelets so your pet's blood will clot, to make sure your pet's not anemic and shouldn't have the procedure. We place an IV catheter and we use IV fluids so that we can keep the blood pressure up, which is very important. And if I need to add a drug immediately, it goes right into the bloodstream. The monitor you see there is actually what we use. On the top, we can look at the heart's rhythm and the heart rate. Underneath that, you'll see the red letters. That is a blood pressure reading. So we know if your pet's blood pressure is dropping, what we need to do. Below that are two separate lines. One is for oxygen and one is for carbon dioxide. We also monitor the temperature. The number one cause of anesthetic problems is low body temperature. And we have a veterinary anesthesiologist here, part-time, soon to be full-time. And so we can ask them right away, come over, look at the, look at the ECG, look at the wave, what would you like us to do? And our technicians are all trained in anesthesia, how to use these machines, how to help when there's issues, what we need to do. We also take radiographs of the mouth, and I'll go over that later in more detail, but that x-ray shows a big black circle around a tooth root. That is an abscess. As I said, we do a detailed oral exam because we may find a tumor or something like that. We use excellent pain control. Your pet gets pain upon being sedated, gets local blocks to help with pain. If the procedure is a long one, we'll get a second dose of pain medicine and they get to go home with pain medicine. Whatever is good, we clean, polish, and apply fluoride. And then the most important part is we have a recovery nurse who is going to watch your pet, make sure the temperature stays up. If it doesn't, put heating support in, take your pet out for a walk if it needs to go to the bathroom, everything like that. Okay, now this is just to show you some of the things with an oral exam. There is a probe with little markings on it, and we know how many markings is normal, how many more markings can be salvaged, and how many mean it's too late. This is a tooth that you could not see with the gum closed. You would have no idea it was there if you had not taken x-rays. And another true story, client of mine had a pug, came in for a cleaning, and when we took x-rays, we found this exact same thing. And on the other side was a little white circle, and I thought it was just a piece of a root. But when I actually inserted my probe, pus shot up all the way to like way up. And I found that side tooth. So if you go to a place where they don't take x-rays, that dog, the owner would have paid what they did. The dog would have had anesthesia and it would be leaving in just as much pain as it came in with. The little thin tooth is a deciduous canine, very common in small dogs. They are supposed to be gone when the larger canine is coming in, and you can say that it has pushed the larger canine in the wrong direction. Frequently, we take these out at 6 months of age when your pet is being neutered. Again, you saw the slab fracture. Again, you saw the resorptive lesions that I showed you. Another really bad thing, I'll go back one more second, is stomatitis. If you look in the back of that cat's mouth, you can see very proliferative bright red tissue. And that tissue is all along the gum line. And this is one problem that you will know your cat has a problem. It is insanely painful. They're actually allergic to their own bacteria. We don't see cavities often, but this is a cavity in a dog. So the holes we see in cats aren't cavities. And unfortunately, we do find tumors in the mouth that you wouldn't have known about if you hadn't done the procedure. So I'm hoping that now that you know everything that's involved, all of the precautions we take, you'll realize why the cost of the dentals are high. And as it says, good work ain't cheap, cheap work ain't good. Okay, getting into some dental x-rays, there is a tooth that looks normal, but on the dental x-ray, you can see that there's bone loss. Everybody who gets a dental here has to have dental x-rays. I would tell you not to get a dental done at any place if they don't do x-rays. This is just to show you normal x-rays, and look at that gray space in the middle of the tooth, the width of that, that's the pulp chamber. And for whatever pet you have, the pulp chambers should always be the same width. This is a cat that had resorptive lesions. If you look at the photo on the left, the root at the top, you could draw a line around that root. Then when you go to the next one, it's completely destroyed, totally 100% the bone's loss. Right next to that one, if you try to draw a line around that root, on the inside you can, but on the outside you can't, because that tooth is being eaten. And then if you look at the bottom tooth, the same thing goes. Try to draw a line around that root closest to the second tooth, and you'll see you lose that line, part of the tooth. So that's being reabsorbed. All of those teeth would need to be extracted. On the far right is just showing you a cat's mouth with severe bone loss. Again, this is an abscess. If you have a fractured tooth, it allows the bacteria to love the blood and the nerve, and it goes right down and causes the abscess. This photo on the left, if you look, these are the 6 incisors at the top of a dog's mouth, and you can see that 2 of them have wide canals. This is what something like this would look like. And you can also see the bone all the way down. It should be all the way up to where the fatter part of the tooth, which is the crown, goes. On the right side, you can see a small dog's jaw, and you can see the difference in the width of the canals. And this poor dog had so much dental disease and so many teeth removed that the bone is just regressing. On the left side, again, if you look at the width in the teeth, the 3 on the left are wider than the 3 on the right, and you can see black gas around the roots. On the right side, that is what an unerupted tooth can do. It forms a cyst. The cyst keeps growing, growing, growing. You can see it hitting the lower canine. It will make the canine eventually get loose and come out, and it's going to be growing downward into the jaw, and you can also have a fracture spontaneously. This is a true story about Ruth and the vacuum. Ruth didn't like the vacuum cleaner, and she bit it. And if you look on the left, that's Ruth's x-ray. On the right part of the x-ray, there's a nice black line going through the jaw. She broke her jaw biting the vacuum cleaner. And on the left side, you can see towards the bottom, black under a tooth, and it's actually into the jawline. That jaw is just waiting to break. Okay, so clients say to me, I hear that you can have teeth done without anesthesia because I don't want to have anesthesia. Absolutely wrong. Okay, first of all, it's not done by a veterinarian, and most of the time, not by a trained veterinary technician. Secondly, they're sharp instruments. If your pet gets scared or moves or jerks, can get cut. The most important part is under the gum line. Remember that green bacteria and that horrible ham story, the bacteria without air? That's where they hang out. And lastly, I don't care what they say. They could be playing Enya and wrapped up in a blanket. Your pet is afraid. Okay, so there is a tooth with the beige color material is bacterial plaque. The pink is the gum line. And in this pet, it's above and below. If you do a non-anesthetic cleaning, they're going to crack the plaque off, scrape it, but they're leaving what's under the gum line, okay? Whereas if you have it done professionally, above and below the gum line is cleaned. Okay, this is just a little video. This was a client of mine, and when she came back with her dog after a dental, what she said made me so happy that I asked her if I could videotape it.
Um, I'm here because Jack I noticed that his breath was awful, and I know looking at his teeth, they look bad. A little nervous though, because he's 13 years and like 4 months old. I know he has a heart murmur, so I'm really concerned about doing it. But I went ahead and did it, and it was the best thing I could have done for him. He's eating better, his eyes are brighter, he seems happier, and although I was afraid, it's the best thing I could have done for him.
So again, people often tell me, oh, my pet picked up a toy that they haven't picked up forever. Or I thought my pet was eating good, but oh my God, now he's ravenous. I didn't realize he was in pain. Okay. So that's why I enjoy this so much. And there's Jack. Okay. What happens if you don't address the disease? Well, your pet is going to have a lifetime of pain and discomfort, and I don't call that a good quality of life. The infections get progressively worse, and you get the tooth. People will say, oh, my dog's tooth fell out, or my cat's tooth fell out, or I didn't know, I never had a dental, but it's missing all these teeth. This is a dachshund, and the canine, you almost can't tell it. It's a lighter brown towards the bottom of the screen, and it's a really dark, ugly brown towards the top. And that canine is going all the way up into the sinus, and the infection is getting into the sinus. We call that an oronasal fistula, a connection. Bacteria gets in the bloodstream every day, and your immune system is busy fighting it, so it's tired. You know how you're tired and when you're fighting an infection. And then you can get complications. This is an abscessed tooth that came out right below the eye. Sometimes the abscess can go up behind the eye and push the eye forward. And this is a carnassial tooth abscess. That tooth lives right under the eye, and a lot of times people will bring their pets in because they woke up with a swelling. Okay, so now we have to talk about what can we do to help. The goal is to start doing it when very early, and we're going to try to prevent plaque from developing. If we have it, we're going to try to remove it and control inflammation. And it does take a lot of effort on the owner's part, and we want to make it a pleasant experience for the pet. I know if I have to do something to my dog and my dog doesn't like it, I'm not going to do it. Okay, so you want to start when they're puppies or kittens. And if your pets now, when you look at them, have bad periodontal disease, after they are taken care of, then you can start brushing. The brush that we like is a regular toothbrush, not a finger plastic brush. That doesn't work as good. And if you look, the bristles are going between the tooth and the gum. We don't want it just to be across the top of the tooth. We want it across the gum tooth connection. This is the next view is going to show you our dental tech brushing her dog's tooth for the teeth for the first time. And before we see that, this is showing you a model of canine teeth. And if you look at that canine, look how much of it is above the gum line. They are huge teeth, okay? Okay, here we go with brushing teeth.
Good girl, Penelope.
So noticed how it was very quick. It doesn't take a long time. You don't have to do the inside. And it was up between the gum. She showed you when she angled it. I think I'm going to play that one more time for you.
Good girl, Penelope.
I also have people tell me, I can't brush my dog's mouth, but I ask them to show me what they do, and they try to yank the mouth open. Noticed how she just slid it in the corner of the mouth. That's all you have to do. Okay, so it can't be, oh, I do it once a week. You really have to try to do it at least 4 or 5 times a week. You want to make it a habit. So you want to try to do it same time every day, same place every day. Actual brushing takes about a minute to a minute and 15 seconds. You do 15 seconds on the top, 15 on the bottom, 15 on the top, 15 on the bottom, and 15 up and down on the incisors and the canines. Okay, we have a phenomenal video on our website about how to brush cats' teeth. And the brush that you see in the upper right corner is the one that we recommend to use for cats. Remember, if you ever try that and your cat chatters, then they probably have one of those resorptive lesions. Another thing that is always said to me is, well, I get their teeth brushed when it goes to the groomers. And what I tell the client, this is like brushing your teeth only when you go to the hairdresser. And that is actually a human mouth who didn't go to the dentist for 20 years. Some things we can do are dental diets. They do require a prescription, but they're made larger to promote chewing because when you chew, more saliva is produced and it helps flush the bacteria out. They also kind of scrape against the tooth, and they have additive agents to try to help prevent. There are chews. There is a variety of them there. The bottom left one is for cats. But what I will tell you is it really depends on what kind of a chewer, mostly for dogs, they are. If you have a dog that just swallows things, it's not going to do anything and it can be very dangerous. It can obstruct their intestine. Okay. We want whatever they're chewing on to be chewed on slowly so that it is doing what it's supposed to do. VOHC stands for Veterinary Oral Hygiene Council. And if you Google that, you'll see a list of veterinary diets and products that are approved by them. You can also buy Healthy Mouth is recommended as a water additive. I do tell everybody, especially cat owners, put it in a bowl of water and have a bowl of water without it. Because I don't know if your pet picks up on a taste, and if they prefer the bowl without it, I wouldn't use it. We don't want to do anything to make cats not drink as much as they could. There's also rinses, or there's gels that you can just put a drop or so in the mouth every day. Now, Whenever anything hard hits another thing hard, one of them has to cave in. And the Titanic was supposed to be unsinkable, and it was hard, but when it hit the iceberg, which was harder, the Titanic went down. So, those things that you see, hooves, antlers, yak bones, ice cubes, nyla bones, they all are stronger than that enamel. And when the two come together, the enamel breaks. Okay, just want to show you this. I'll go back again. This is a dog, loves carrying his tennis ball. Well, look what it does to the teeth. Tennis balls have nylon in them, and so it's constantly filing the tooth down, filing the tooth down. Sometimes we see dogs with this who have terrible skin problems that weren't treated because they gnaw on their fur so much that it wears the teeth down. Okay. Again, there's a fracture from something hard. And then these are some toys that won't break the teeth. And like the one in the top right is a dental Kong toy where you could put like yogurt in between it or dog toothpaste, something, and the dog would gnaw on it. And that gnawing action would help with the teeth. So there is no easy answer. There's no one thing that I can say, oh, your dog's allowed to chew this. Basically, if you can bend it a little, it should be okay. And monitoring if your dog swallows things and wouldn't chew on it, it's not okay. Okay, so I think that we'll be able to fight this battle if we all chip in. And what I'm going to do is go to take any questions that have been there now. Okay, I don't know if I have any.
I have a question.
Yeah,
Okay, so I just had my dog there for his first checkup there. I was at another facility before, and actually I've been to Mount Laurel Veterinarian with my other two dogs, but they're no longer with us. So anyway, my dog had to be medicated for a well visit because he's very anxious. He was actually we think it's because he was kicked in the face at 4 months. He had multiple fractures in his facial bones and orbit and
What?
blah blah blah. So
Also blocked in video.
I want to see the video. How do I see?
I don't know
So-
what's happening, but I'm hearing
somebody else took their mute off. But anyway, I had mentioned to the doctor that his breath really smells. He's only 2.5, but it's just on the one side. It's the back tooth upper, and then the I guess the canine. There's just a little bit of spot on the top of the tooth, and she said she did see that, but otherwise his teeth look really, really good. And she said maybe next time I come with him, we could do a dental because she said she didn't think it was necessary at this point. But my question is, do you think any of these bones that you just pointed out would help get some of that off now, or is it just too late to do that? Or
no, it's going to break the tooth and you're going to have it removed. Now, if the breath is bad on one side only, for sure, then I do think something can be going on because it shouldn't be one-sided. The breath is bad, it should be bad on both sides, okay? So really make sure that it is just one side. And if it is, then
it is. She said, well, I could see his teeth too. And the doctor at Mount Laurel said that his teeth are fine, except for those two
right.
that have a little bit. And he's missing a bottom tooth on the left side. And she said it could be that he's chewing more on the right. And that's why maybe some plaque or tartar's building up more on just the one side, because he's missing the bottom, the big tooth in the back. Or I don't know which one it is. I don't know why he's missing that tooth. Perhaps I never noticed it, but perhaps it was when he was kicked in the face. Maybe he got kicked out. I don't know. So if that makes sense.
Yeah, but another reason is that you do need dental x-rays to see maybe the
Right,
tooth was broke at the gum line and underneath
right,
there is a root, which is painful. Maybe he was born without it. There's no way of knowing just by looking when it's not visible that it's
right,
actually there.
right. Yeah, she just said that, I had to do the well visit first before you would consider him for a dental, which I would be definitely want to do.
Yeah, and that's
So,
because if I notice anything wrong, say your dog has an arrhythmia, cardiac arrhythmia, I'm going to want you to figure out what's the cause of that before we put it under anesthesia. Or definitely want to know if you have a heart murmur, so I can plan the right drugs to use. Uh, Maybe there's a growth that I noticed that you didn't realize was something that could be potentially dangerous and should be removed. So that's why you need a regular exam to assess the overall health of the pet.
right, which I just, right, like I just had that two weeks ago, actually.
Okay,
And he had blood work and all the blood work was
good,
fine and the
good,
heart, everything was good.
good.
Yep, it was all good. So if I think that I'll see what I can do and then I could schedule a dental maybe in the next couple months or something, but
Sure. That
okay,
reminds me, because of COVID in the very beginning, we were not allowed to do elective procedures in case humans needed the surgical gloves or um, I'm trying to think, what is it? The oxygen, the rebreathers and all of that. So our hospital, and I think every hospital around, is really backed up in dentistry. And there's usually a 1 to 2 month wait, unfortunately,
right,
before you can
okay.
get done.
All right, well, I could consider then just making an appointment in a couple of months then.
Yeah.
Okay.
Anybody else have a question?
Hi, Dr. Hoffman. This is Rona.
Hi,
How are you?
I'm good. How are you?
Good. Thank you first of all, thank you for hosting this. This is awesome.
Oh, I'm glad.
And second, I have a question. My dog, when we brought him to you, his name is Duke,
Okay.
and he had this temper. You said that he had this temper, so his teeth had really bad enamel from
Yes.
get go, and he had like a twitch on his right leg.
Yes, I remember him. I love him.
Oh yeah, so well he's 60 pounds now. So it's
Oh
like
my God.
anyway, just wanted to, besides the brushing of the teeth, and we need to do a better job. I mean, I this is like an eye opener for me, your talk about, just dental health. But with his teeth, and a lot of them have that brown line, brown, it's like brown all over.
Yeah.
What's the best way to care for his teeth?
Okay, so just for everyone, this poor little guy had the disease distemper, and distemper attacks the enamel of the teeth. And so, A, he would be a dog that really he couldn't chew anything hard because there's really not any protection. And B, the discoloration, it doesn't mean in his case, oh, he's got periodontal disease. So brushing his teeth is basically the best thing you could do for him.
Okay. All right. That sounds good.
Yeah.
Yeah. How can I tell, I guess, is it the bad breath? Like, let's say there is something real there. How, because it's hard to tell with the enamel, um, if there's something really wrong.
Well, what you can look for, remember I showed you how the gum gets
Yeah.
swollen and
Yeah.
red. If you start to see stuff like that, then you know
Okay.
that's a problem.
Okay. Sounds good. And when should he be getting, the X-ray? Like, is it a year, every year, or like what's the frequency of that?
Well, it depends on the breed, because like I said, there are some breeds that are really prone to it.
Okay.
Or B, if you're doing really good home care, then
Mm-hmm.
you don't need to. On the other hand,
Okay.
I do have a client who comes every year with a small white dog, and the dog's never lost any teeth because she does yearly cleanings. So,
Got it. Okay.
okay.
Sounds good. Thank you so much.
Oh, you're welcome.
Hi, Dr. Hoffman. This is Karen Mile-Carrick. We have Rolo, the chocolate lab.
Okay.
You probably know her. We've been in for cleanings, I guess. I do one every other year, but this
Okay.
time she just turned 4 in November, and I noticed that she was a lot slower to kind of rebound from the anesthesia this time. Not overly so, but it made me a little bit hesitant about planning another one for the future. I do try to brush her teeth kind of regularly, and we do use a product called Plaque Off.
That doesn't really work.
Plaque Off isn't good because it was on that VOHC website as an approved product.
When it first appeared, it said it would get rid of that thick mineral and everything like that,
Mhm.
which it doesn't do. But if the VOHC has approved it, then I guess there's something behind it.
Right. I mean, her teeth are pretty good. I worry about the anesthesia. That's really my concern.
Now, what you need to do is let us know, because maybe the doctor who did it used a drug that wasn't used in the prior dentals, and therefore we should avoid that drug in the future with your dog.
Okay.
Okay.
Okay. I will definitely let them know because, it is something that I want to keep in tabs with regularly for her dental health.
Right. And
Okay,
we have a
thank you.
big like pop-up, like, don't use this medication with this dog.
Okay. All right, great. Thank you.
You're welcome.
And thank you for this. This has been great.
Oh, I'm glad you liked it.
Dr. Hoffman, this is Marilyn Griffiths.
Oh, hello. How are you?
Hi, we're coming in July with Nora to see you, but she does get her teeth brushed every day by Owen. But we're noticing a tooth. I don't know if it's protruding a little bit. Can their mouth get crowded? She's 3.5.
Yes. And she also is a shorter face. So crowding of the teeth is something that happens.
Oh, so when you see her in July, then you can make an
Yeah.
assessment, because I think she probably should get cleaned this year.
Yeah. Yeah. Remember, I showed you that plastic model of the tooth where how long it should be. So anytime you have a smaller jaw, they're just crowded. They go sideways or they're
It's
born.
on the bottom. Yeah, it's on the bottom.
Yeah.
Just a little. Yeah. Well, we haven't done anything because she just had the surgery.
Yes.
On eyes.
Good.
Yeah. So we'll see you in July, but that could happen. The tooth can move.
Absolutely.
Oh, any question for doctor yourself? He brushes every day.
I love it.
All right, we'll see you soon. Thank you. This is great. We learned a lot tonight.
Okay, good. You take care. Give her a kiss.
I will. She's right here, actually. Show her. Show her. There she is.
There she is.
Oh, there she is, that pretty girl.
Her eyes are beautiful.
They really look good.
Yeah, they came out nice. Thank you for the.
Yeah.
I like Dr. Jocelyn. Thank you.
Great.
By the way, we use a toothpaste, and maybe you don't. What do you
It's
use?
Arm and Hammer.
Arm and Hammer. What do you think? He's been doing. Should we use that CET or whatever it is?
Yeah, you mean there's pet Arm and Hammer toothpaste?
Yes.
Yes,
Oh, all right. If it's made for pets, that's fine.
it is fine. Okay. All right.
You
Great.
can even use water. It's the mechanical action of the brush that counts.
Oh.
And we use the double-headed one that you gave us to use. We still use that.
Good.
Okay.
And remember, change it out just like you would yours.
Oh, we do. Oh, we do.
Mhm.
Oh, yeah, we do. We follow your instructions. Yes. Thank you.
You're welcome.
That's your doctor. Yes.
See you later.
Is it best to use a soft bristled toothbrush? Like a
And
human toothbrush?
yes, you want soft. So I tell people either if it's a big dog, buy a soft adult. If it's a small dog, buy a baby brush.
Okay.
Okay.
Yeah, we have a soft adult. Okay.
Okay, good. How's it going? Good.
No, she's horrible. I have to have somebody hold her so I can get in there because I do see some of the tartar on her bigger tooth, and I try to brush that off and try to focus on that area. But
And
no, she's a total pain in the butt with it.
Are you just sliding it along the gum line, or are you trying to open her mouth?
We're trying to open her mouth so I can see
Really?
because she clamps down and she's like,
Yeah.
nope.
No, you don't want to do that. If you just slide it in along the side and go all the way back below the eye and start there, you'll be getting that big tooth. So that's part of the problem.
Yeah, well, I try. It's always an adventure. It's my dad's got to hold her against himself, and I got to get in there, and it's
My
always like
God.
he doesn't even want to come by us. I'm like, nope, come on, come on.
Aw. Well, try to think about restarting slower, have the best treat that she loves. She only gets it when she gets her teeth brushed. And, just slide it in, don't open it up.
Okay, well, we'll try that. Thank you.
Okay, good. Anybody else?
I'm
How
just
about,
curious. I'm
oh,
sorry. I'm just curious about why would you not need to brush the inside part of the teeth? Why just the outside part?
Well, ideally, brushing inside would be great. However, pretty much every dog won't allow that. I have had some clients tell me their dog allows it, but that's why we usually just say do the outside. And
Okay, thank you.
yeah, and when I do this, the periodontal disease is on the outside and the inside, but it's always much worse on the outside. So if your dog would allow it, that would be really great.
We'll give it a try.
Okay, good.
No promises.
Dr. Hoffman,
Yeah.
I forgot to ask you, how long does the procedure for, this is Marilyn again, I'm sorry. How long does the procedure take? Does it depend upon the dog or what you find, I guess?
Yes, both of those. Now, she's a small dog, so
Uh-huh.
probably it would take about an hour to take her x-rays, clean, and polish her teeth. When we have
Okay.
large dogs like a lab, it takes a long time to get x-rays of that whole mouth and do all those teeth. And then, of course, if there's periodontal disease, then that always takes a lot longer. And I tend to do the really diseased mouths, and most of my procedures are 3 to 4 hours. So I only schedule 2 a day with me because of that.
I mean, the dog is on the table with you 3 to 4 hours?
Yeah.
Wow.
But that's why we have all those precautions that we take.
Yeah. Oh, yeah. Oh, I hope we do well in July.
Yeah.
Want to see you.
Yeah, I
Okay.
don't think she has that kind of disease that'll.
Yeah. And medications, I heard you say, can affect their teeth too.
Yes. Like, for example,
Antibiotics.
tetracycline when they're growing, but like one of the drugs called atopica, which
Oh, we didn't get that.
that's
Okay.
used for allergies. Over time, that can cause gingival hyperplasia, that kind of thing.
Okay. I think we're okay with the meds she had. Okay. Okay. All right. Great. That was good. Thank you.
this is Sharon White again. I just have another question. Can I assume that depending on the extent of the disease, that the cost would be higher for a higher
Absolutely. Absolutely.
extent? Okay,
Yeah, it's surgery. So you're paying
right.
for surgery time. So we have like the base price that includes everything I mentioned, except for the time to surgically extract the teeth. And it's it's almost like really fine needlepoint, very tedious work, especially if it's a toothway in the back. And we use very fine suture to close the extraction sites. And you have to be careful because if you're trained, don't go to certain places where there's blood vessels or a nerve that you
Right,
can cause trauma to.
right. Okay. And another question, are there any other bones like the real bones that have marrow in them? Are they bad or good? See, because my dog does use them, and honestly, he scrapes his teeth on them pretty good. And I feel like that helps, but I'm afraid now that it's going to break a tooth
Right.
because
So
of what you said.
yeah, that's the catch-22. I'll be honest with you. I used to give my dogs bully sticks, and then my one dog got a small fracture in the biggest tooth in the bottom jaw, and I had to have a root canal done, which is outrageously expensive. And then in theory, you're supposed to check every 6 months that the root canal is still good. So after that, I took the bully sticks away. That one dog, once I took them away, developed plaque and periodontal disease really quickly. So it was like, do I give her the bully stick and it keeps it away, but she could break her tooth again, or do I don't? So it's it's a hard decision.
Okay,
Hindsight
you.
2020, right?
yep. Okay, thank you.
You're welcome. Anybody else? Well, I think that you're all great pet owners for spending your time and learning about this. And all in all, it's going to make all of your pets happier, healthier, feel a lot better, and you should be proud of yourselves. All right, well, enjoy your evening.
Thank you, Doctor.
Hey, Dr. Hoffman.
Very informative. Thanks so
Thank
much.
you.
Oh,
Thank
you're
you, Dr.
welcome.
Hoffman. We love you.
I love you.
Thank you very much.
Thank you. Thank you.
Thank you
Have a
very
good
much,
night.
Dr. Hoffman.
Bye-bye.
Bye.
Bye. That was nice.
Bye.
Bye-bye, dear. Good night.